Hi, everybody, and welcome to the Vermont Affordable Housing Coalition's latest installment of In the House. On In the House, we talk about the affordable housing crisis here in Vermont through the lens of how it kind of impacts various communities of Vermonters specifically. And so during this month of December, we're talking to Peter Jacobsen from Vermont Cares. December 1st is World AIDS Day. And so throughout the month, we kind of have a heightened awareness about how HIV and AIDS impacts the lives of our neighbors in a particular way. So Pete, why don't you tell us a little bit about the work that VT Cares does?
Sure. Vermont Cares is a 35-year-old organization that's been providing HIV-related services across the northern and western part of Vermont for quite a while. And we've been expanding our programs, especially during the time of COVID. What I love about Vermont Cares is that we were formed by a group of grassroots volunteers who helped care for each other in the early days of HIV when less was known, no testing was available, no medications. And it's grown so much now that we can house people with HIV effectively, help them get access to healthcare and medications. We can help connect people to solid HIV prevention mechanisms like HIV PrEP, very quick 20-minute HIV testing, and also a really expansive sort of universe of syringe service programs across the state, which are sites where people can exchange used injection equipment to stay safe from HIV, hepatitis C, and certainly overdose. So we've been really proud of our ability to expand all that during such a challenging almost 2 years now. Well, I think we're lucky to be having this conversation in Vermont, honestly. We have legislature, we have communities that really care about the healthcare of people with HIV and care about housing. So I think the Vermont story is really different than some of the stories we see in other cities and states. In Vermont, we're generally looking at about, from our caseload, we serve about a third of all people with HIV in the state, most of whom are lower income, most of whom just need a little bit of support just to stay focused on their medication to stay healthy. So of the 180 or so folks that we're working with through case management each quarter, for instance, we're generally seeing about 5% of them experiencing homelessness at a time. And there's such a direct correlation between experiencing homelessness or housing insecurity and not being able to take your medication. I can pretty much correlate one for one the healthcare outcomes of someone with HIV based solely on their housing. And then the flip side, of course, is when people are more stably housed, it means they're able to focus on getting to doctor's appointments, storing their medication effectively, taking it on a routine basis. The causation and correlation are so direct that it's been sort of underwritten by Housing and Urban Development at the federal level. And then state government as well really appreciates that housing is pretty much our number one priority for folks. Folks, now that the COVID restrictions in Vermont have lifted, we have folks coming to live back close to their family of origin, coming to access the superlative HIV healthcare that our state has to offer. And they're just not able to find affordable housing. So even when they have a mechanism to pay for it or can pay for their own rent, there just aren't units out there. So we're definitely feeling the pinch of a really limited affordable housing stock. It's been a challenging year trying to navigate housing. It's dynamic, it changes all the time. There are new rules, new funding sources. If you are an individual who is not housed today, then trying to navigate this sort of landscape is time-consuming, it's exhausting, it's demoralizing, and our folks deserve better. if you, for instance, are income eligible and can get onto a waiting list for a housing voucher through a local housing authority, and that housing authority then lets you have a voucher to pay for your housing, the upper limit for many of the vouchers that are out there, the upper limit is so low that most rents in this town aren't even really approachable for people who need help paying for those units. So I would urge our state to focus more on housing that is safe, that is economically approachable, and that stays that way for the long term, where rents aren't jacked up year after year. People on a fixed income don't have a lot of flexibility to pay for that. As I said, most of the folks we serve are earning less than $20,000 a year. That's more than 90% of the folks we serve. And with such a tight margin, paying $1,700 a month for rent just is not ever going to be sustainable. So I think, yes, there are options out there. Do I believe it's going to cost hundreds of millions of dollars? Yes. Do I believe that is a worthwhile investment? Also, yes. That would be my number one priority for policymakers, decision makers for 2022.
Thanks, Peter. Thank you, everybody, for joining us on our latest edition of In the House, and we'll see you next time.